As you will note, Mr. Speaker, that Parliament gives us the opportunity to make statements and to inform the public of the stewardship that we undertake. It is so important, Mr. Speaker, that it comes long before any public bills. And so I take the opportunity now, Mr. Speaker, to address three matters. One, on the program as we progress with universal health. Two, on issues with regard to health and how we are working through the Solid Waste Management Corporation to improve the quality of health care. And three, on what we just achieved earlier this year, a few weeks ago. And I will start with that one, Mr. Speaker. The vessel monitoring system, the VMS, that the government procured and distributed to fishermen. Not only fishermen in St. Kitts, but also fishermen in Nevis, those who take their boats out to go fishing. We consider this, Mr. Speaker, a very important event, a very important undertaking. Because over the years, a number of fishermen have either gone missing or have lost their lives at sea. We know that the unforgiving nature of the sea has impacted our nation in many ways. It is a huge burden on fisher families to carry the weight of sometimes inconsolable grief associated with the loss. We know that families have often found new sources of support to cover their responsibilities of their homes. And the community also loses because key providers of fish protein as well as social institutions that coagulate in various personalities, especially at the time of the sale of fish, is lost. There are a number of incidences that have occurred since becoming minister responsible for marine resources. We know of Wilson Keynes, we know of Alton Sadler, we know of Vernon Pemberton, we call him Finney, very close friend of mine. We know of Hayden Langlis, either who lost their lives at sea or we can say are still missing over some time. And we also know, Mr. Speaker, that just 3 weeks ago, a similar incident almost occurred where a cruise ship was reported to have hit a fishing vessel owned and operated by Francis Langlis, and this happened south of Nevis. Thanks, of course, to our Heavenly Father. There was no loss of life on that occasion. Given the unfortunate regular occurrences of these incidents, the government of St. Kitts and Nevis has decided, in fact, we decided very early in the term of the administration, and we worked on it over the last 3 or 4 years, we decided that we have to improve the safety of the fishers who are at sea, provide safety for the vessels as well as life, because they play such a significant role in providing protein to our nation. And so we set about and we procured some vessel monitoring system. The vessel monitoring system is a satellite-based monitoring system which at regular intervals provides data to the fishers' authorities on the location, course, and speed of these vessels. The vessel monitoring systems are now considered as a standard tool used for fisher safety in St. Kitts and Nevis. And now we are the first nation in the region to introduce this as a compulsory means of tracking for all of our fishing vessels. We will monitor vessels in the territorial waters of St. Kitts and Nevis and in the exclusive economic zones. We can extend monitoring up to 200 nautical miles. The vessel monitoring systems will improve the management and sustainability of marine environment by ensuring proper fishing practices and the prevention of illegal and unregulated and unreported fishing. It will help our Coast Guard in any of its search and rescue efforts when and if there is any report of distress by or coming from any of the vessels while at sea. The cost, Mr. Speaker, of each device, and we've got over 300 of them, is $300 US per device. And the government has taken the initiative and has underwritten the cost of providing a system to every fisherman. So you're considering a government that has decided to find 300 US for 300 fishermen, so that each of them and all of them can have on their vessels a system that can guide authorities, people who are searching, and guide them as to where they are at sea at all times. As I understand it, Mr. Speaker, signals will come to the central point on shore from time to time, I think at intervals of every 15 or 20 minutes, so that you'll be able to track, monitor, and understand where vessels have the path that they have taken. And it is saved for posterity, so that at any time one can go back and look and determine what happened on a particular day with a particular vessel when it went out to sea. In addition, Mr. Speaker, to the $300 per unit, in order to license, the cost of 143,000 US on the low side and 156,250 US on the high side, to pay for annual licensing of each device. And again, the government has underwritten that in the first 3 years. This, Mr. Speaker, is not only done for St. Kitts, but also for Nevis. It demonstrates the partnership that we have developed, significantly better partnership than any time in our history since the installation of a government of national unity. Mr. Speaker, one of the very important reasons why I admire the work of those persons who are at the Fisheries Department to set about on this course is we have had reports of persons going to sea, and you get all kinds of reports about what happens at sea with fishermen. And we also have reports of people going out to fish and they're not fishing. And it is a tool that, while it is important to the safety of the fishermen, remember I told you, Mr. Speaker, I think some time ago, I told the Parliament some time ago, that there was a boat near St. Paul's, the area, and they were going out fishing. And because of the sargassum seaweed, one of the engines got stuck and apparently stalled. And while they were working to free that motor, that engine, the other one was just punting slowly, because of course they cut that down to be able to deal with the one that had stalled. And what happened next was that a wave came and knocked both fishermen overboard. And because one of those engines was slowly going, the boat began to move away from them. And though they tried to catch that boat, they could not, and eventually made up their minds to turn back to shore. And in the process, one of them perished. If, Mr. Speaker, the vessel monitoring system is on board and they were in a position to only give a signal, or even if they didn't give a signal, at least when the alert was raised, right on shore, you could then identify exactly where that ship, that boat traveled, the course, where the boat is even going on its own. And perhaps, Mr. Speaker, it does significantly raise the prospects of some life being saved. We also know, Mr. Speaker, of Finney and his partner who went out. And to this day, Mr. Speaker, we really don't know, but it's 3 or 4 months now. And there is no clue as to what happened, where it happened, but they just cannot be found. With a vessel monitoring system on board, there would have been an opportunity for us to be able to send in a particular direct point, a direction where that boat last pinged. And it may even still have been pinging at the same time. And perhaps lives could have been saved. And so, Mr. Speaker, I just report to the country that this government saw this as an important must for saving lives, for the security of our people while they're at sea. And it is also an advantage to those who are in law enforcement, those who are in the search and rescue unit, to be able to use the data to be able to find any of our fishermen who find themselves in difficulty while they're outside preparing our breakfast and our lunch. Mr. Speaker, the second matter on which I would like to report and make a statement, on the 21st day of September last year, while we were enjoying our independence, the Solid Waste Management Corporation, in support of the Ministry of Health and all of the initiatives to which the Prime Minister spoke, the mental health, the oncology units, the Mary Charles Hospital, etc., etc. In support of that, we launched a program to remove all of the debris strewn across the country in fields and just near the side of the road or wherever. Remove them to the landfill site. And so bins were placed in every village, in every community, giving people an opportunity to remove it from their homes if they have it in their homes. Those old refrigerators, old stoves, washing machines. And if it is nearby in the bushes, to remove them as well. It was a successful initiative in that every person with whom I have spoken, and I've heard spoken if they're not even speaking to me, indicated what a great initiative it was and how they thought it was something that the government did that had never been done before, and that they would like to see it happen again. I did not agree with that last part, because I thought, Mr. Speaker, if I clean it up now, you don't do it again, so that I wouldn't have to come back. But if we have to, Mr. Speaker, we will, because the intention is to make sure that our surroundings are clean. When anyone visits this country, and I hear them sometimes, the roads are so good and the place is so clean, they must go away from this country feeling that they've come to a place that is not only safe, but it is clean, the environment is clean. And they must feel that they have come to a place where there's no health hazards that they can run into. And so, Mr. Speaker, having done that, we offered an opportunity to every person who has a derelict vehicle to take those derelict vehicles to the landfill without being charged for taking them there. Because our effort was to make sure that we continue to clean up this country. We haven't had many persons who have done that. Some have. And so there's still a lot of derelict vehicles out there. But, Mr. Speaker, that again was successful in terms of some went and took their vehicles there. In order to continue that process of cleaning up the derelict vehicles, we engaged an organization, Enclave Resources, a USA-based organization. They have come in to bail out all of these derelict vehicles and are currently, for the last 3 weeks or so, they are on the landfill doing the compacting of those derelict vehicles, taking them out of the country. We might find that material back here in some other form, maybe in another vehicle or something. But they are working to make sure that we remove all of the derelict vehicles so that they can be recycled. And they're sending it, of course, to Florida, where the steel mills company will, in fact, recycle what we have submitted. But they're going to go further, Mr. Speaker. And this is what I want the public to be aware of, that there are still a number of derelict vehicles across the country, and we will move to take them up. We will issue the necessary certification or certify or order, whatever is necessary, to have them removed. And when they are not removed by you, we will remove them. Because we cannot have derelict vehicles across the country collecting water and having stagnant water that is a home for the production of, for the birth and production of mosquitoes. And so we will go that route, Mr. Speaker, to further clean up the country. And a lot of that will be taking place in 2019. And we have gone further, Mr. Speaker, because over the years, the garbage trucks that we have had at the solid waste, we had, I think, 1.5 limping. We have now added 3 new garbage trucks to the fleet at solid waste. And they are even different to what we had before. In that, Mr. Speaker, there is a cabin at the back of the driver that could hold 3 persons working on that truck. The importance of this must be known, Mr. Speaker, because we have had incidents in the past where individuals working on those trucks have lost their lives. And so in traveling distances, we will urge, and we have urged, and we will continue to urge those working on the trucks to then go inside the cabin, reduce the risk of them losing a grip on the truck or an accident with the truck resulting in a loss of life. These trucks, Mr. Speaker, has now helped us to reorganize our collection days, improve on the collection days. And we will go further, because we are considering that what you call it there again? Not Wellington Road, Manchester Avenue. In the Manchester Avenue and that area, you have some small roads. And these huge garbage trucks really cannot get through those roads. So we will be then investing further in smaller trucks so that those who live in those single traffic roads can then have their garbage removed as we go through 2019. Mr. Speaker, one of the main reasons why we are paying such attention to this important cleaning up of the country. About a few weeks ago, you heard the story of Guillain-Barré syndrome. It is a disease that is spread by the Aedes aegypti mosquito. And we already know dengue, we already know chikungunya, we already know Zika, 3 diseases that impacts the quality of life of individuals. In fact, the Zika has been known to affect pregnant women in a way that they give birth to children with small head. There's a scientific name for it, Minister Phipps. Can you help me? That is what? For the small head baby that's born. Let's see, I can't even call the name properly. But the point is, these diseases can affect the quality of life of not only the individual who is born, but also the entire family, because then they have to provide additional care. Well, Guillain-Barré disease is known to cripple, incapacitate, maybe cripple is the correct word, individuals who get that disease. And while it has not come to St. Kitts and is not so widely spread, while it is not known to have come to St. Kitts and spread across the country, there is also the risk of it coming to St. Kitts. And so that is the reason why I'm encouraging the cleaning up and the removal of these debris, the old vehicles, so that water, stagnant water, will not breed these mosquitoes, so that these diseases can spread in our federation. And so I want to congratulate those persons at Solid Waste and to thank them for their hard work over the last few months in particular. Their hard work in adding to the health care delivery and health care services, ensuring that this nation remains safe from diseases. I do want to thank them for their work and to encourage them to continue to do more and more so that all of us can sleep at night and feel safe. Mr. Speaker, it is one of the reasons why I also want to mention in this vein what has happened in Connery. Because in Connery, where we have the landfill, we have never really had a health center. And one of the challenges for those persons in Connery, one of those challenges is for them to access immediate treatment. And sometimes they have to find themselves in Bastia, down to East Bastia. What this government has introduced last year, and which is now very successful, because I'm hearing numbers like 80 and 70 people going to this health center. We now provide the opportunity in the community center for a doctor to be there twice per week, and when we look at the data, we may have to increase those days. But for now, there's a doctor there twice a week so that persons living in Connery can get access to services, access to health services.
In Connery.
Right in Connery Village. That is the important. When we make decisions in this government, Mr. Speaker, we're making it so that the greatest number of people, if not all the people, can benefit from what we're doing. And that is the importance of having a health center in Connery. And I want to thank Dr. Warner. Dr. Warner, she also lives in Connery. Thank her. Whenever I speak to her, she is very pleased with what's taking place in Connery. She always, in fact, she was calling me this morning, I guess, to give another report. But I'm grateful for the work that she's undertaking there and the young lady who works with her. And Mr. Speaker, the final thing I would want to make a statement on is on the universal health issue. And while I have about 10 pages, Mr. Speaker, I'll just speak to about 2 or 3 because it will probably be too long for this time of day. But I just want to report, Mr. Speaker, that on Friday the 23rd day of February 2018, the process for the design of the National Health Care Coverage for the Federation of St. Kitts and Nevis was launched at the St. Kitts Marriott Resort. At that event, the exchange of contractual instruments was performed between the government of St. Kitts and Nevis and the University of the West Indies St. Augustine campus. At that event also, the membership of the National Commission for Universal Healthcare was introduced. Now, the University of the West Indies Health Economics Unit contracted to study the local situation so as to advise the National Commission and the Federal Cabinet on the best approach to introduce national health care for the Federation. The Health Economics Unit has extensive experience with designing such systems, as they have aided fellow Caribbean countries before, Caribbean nations such as Jamaica, Turks and Caicos, British Virgin Islands, Suriname, and recently Grenada. The local team from the university was joined by Dr. Carl Theodore, Dr. Stanley Lalter, Mrs. Patrick Westcott, and Mrs. Charmaine Metivier. and the other members of the team stationed in Trinidad and Tobago held consultations with a wide cross-section of stakeholders in order to complete what their contractual agreement was. They had to review international experiences with universal health coverage and apply those lessons to St. Kitts. They had to look at the St. Kitts Nevis macroeconomic and demographic profiles, and analyze the burden of disease, health services delivery capabilities of health in the Federation of St. Kitts and Nevis. Look at the demographic trends and the implications for health in St. Kitts and Nevis. Look at the costs of the proposed benefit package of health services for St. Kitts and Nevis. Review the feasibility and quantification of the UNHC NHI revenue generation opportunities and options. How we're going to raise the money. And of course, options to prepare systems. And having done all of that work, they understood that their work had to be complemented by the support of the government. The government, of course, was asked to identify a national team of experts and the formal establishment of a project implementation team, and we have done that. We've done that. We formed the National Commission for Universal Health Care, and it was launched in February 2018. We were asked to create a formalized steering committee to give direction and liaise with the consultant. Again, we have done that. The commission was charged with that responsibility. The government was asked to be responsible for the communication process, which was supported by the consultant. Again, we have done that. The approach included the creation of a Facebook page, the posting of a green paper on the website, town hall style meetings, meetings with key stakeholders, and meetings on radio and television. We've had interviews. So that the government has been carrying out its task towards the nation being ready for universal health care. Of course, the government has the responsibility for governance and so on. And so, to fulfill that obligation, the National Commission for Universal Health Care approves 3 persons to visit the Turks and Caicos Islands. They visited the Turks and Caicos, they visited the British Virgin Islands, so that to get first-hand information, upfront data on what happened in those 2 territories as we work on our own program. And then, of course, we are required to provide actuarial support so that the actuaries can quantify the main variables and related assumptions. And to do that, we have engaged with the assistance of PAHO. We have engaged the firm with a well-known person to St. Kitts and Nevis, Derek Osborne, who does work for Social Security system and our own Social Security system, who is currently working on the costing. I expected it to be any time now, and while I cannot give you the date, I expect that it will be before the end of this month. And so, Mr. Speaker, I make that statement just to bring the public up to date as to where we are, because once Mr. Osborne and his team finishes their work and we understand the costings for the various areas, like costings for doctors' visits, costings for major medical, costing for overseas care, then the government will be in a position to make the decision at what pace and how to implement our universal health coverage plan. I make that statement, Mr. Speaker, because when the team carried out its work, questioning and seeking responses from individuals, they identified the highest area identified by the persons who were polled, who were questioned, identify overseas care more than any other area with which they were concerned and needed help. And so, Mr. Speaker, without going further on this, and until we get the report from the actuaries, I thank those who have been working through the commission, those persons who supported at the town hall meetings, those persons who engaged on radio and television, those persons who have written submissions, who sent papers in with positions, and there were quite a few of them, recommending approaches to this, the implementation of this program. I want to thank all of them, and I want to thank the general public, and so too, Mr. Speaker, members of this parliament whom I usually challenge, especially in the opposition benches, where I'm calling upon, hopefully, to be fully supportive of the implementation of universal health coverage when it comes. Thank you, Mr. Speaker.